I'm going to be doing a central line placement today, so I'm going to identify my patient, explain the risks, indications, and alternatives, and how the procedure is going to go. This patient's a hypotensive female that we have to give vasopressor medications to, and vasopressors are vesicants and can destroy tissues if delivered in a peripheral IV. So we have to use a central line. The risks of this procedure would be pneumothorax, embolism, and bleeding. How the procedure is going to go is I'll have the patient lie in a slight Trendelenburg position. I'll sedate them, give a little local anesthetic at the puncture site, insert my central line, and that line's going to remain in there for a few days while giving medications to this patient. I'll have the patient sign a consent form. I'll gather my supplies, central line kit, gloves, gown, mask for my patient, sedation meds, and an assistant if I need. I'm going to position my patient in a slight Trendelenburg position. I'm going to hook them up to monitors because we're looking for any sort of ectopy when inserting the guide wire and the central line, as well as the patient's going to be sedated. I'm going to give my sedation meds, 1 milligram of Versed, 40 milligrams of ketamine, and I'm just visualizing external structures at the thyroid and the triangle formed by the sternocleidomastoid. I can start opening up my kit. I'll put on my gown. The patient has a mask on. Put on my sterile gloves. I'm going to do a wide prep from the internal jugular all the way to the subclavian in case I have to change sites. I'll let that dry. Great, my patient. I'm going to flush my central line kit, or central line, with normal saline to avoid giving air. I'm going to drop my medications, which is going to be 1% lidocaine. Draw up a CC with that, with a blunt needle. Switch to a 25 gauge needle. Make sure my other supplies are ready to go. So I'm going to be looking at the thyroid and the sternocleidomastoid triangle, palpate the carotid artery. Every time I'm going to be manipulating with the needle, I need to palpate the carotid in order to not inject it. A little posterior to the carotid, I'm going to do a skin wheel. Some people may use a finder needle as their first step, but I'm just going to use my introducer needle. I'm going to be aiming towards the ipsilateral needle and going in at a 45-degree angle and aspirating as I inject until I get venous blood. Looks venous and it's not pulsatile. I'm going to secure that needle, grab my guide wire. I'm going to thread it about 10 centimeters, watching for any ectopy. Grab my razor or my scalpel. cut right at the guide wire. I'm going to thread on my dilator. Insert that a few centimeters. Remove that. Never let go of the guide wire. Grab my central line. Thread that through. It's going to come out the brown port. This is going to go to a depth of about 16 centimeters, or height in centimeters divided by 10. Once that's at the adequate depth, I can remove my guide wire. I'm going to flush and aspirate all my ports to make sure they're patent. I'm going to suture my central line down and order a chest x-ray to rule out any pneumothorax and to verify correct placement. I'm going to document vital signs every 5 minutes for 15 minutes, chart the procedure and how the patient tolerated it. Now I'm going to do an arterial line placement. So this is going to be on the same patient. I identified the patient. It's going to be for hypotension, explain why we need it. We need a real-time monitor of their blood pressure, and a non-invasive cuff isn't going to be adequate for their safety. Complications can include bleeding, nerve injury rarely, hematoma. So I'll have them sign a consent form, gather my supplies. My supplies are going to be my lidocaine and a syringe, any sedation if the patient weren't sedated already, an arrow, sterile gloves, gown, and an assistant to help me with the transducer and set up the pressure bag. So I'm going to do an Allen's test. Make sure they have adequate blood flow and collateral circulation. Verify that everything, all the color and blood flow returns within 5 seconds. I can grab my sterile prep. I'll position my patient's hand. I can put a roll underneath the wrist to extend it, and I can tape the wrist down if I need to. I can start prepping my patient's wrist. Open up my supplies. Put on my sterile gloves. I'm going to now palpate, inject a skin wheel of 1% lidocaine. My arterial line arrow. I'm going to hold it like a pencil. Palpate the pulse with one finger. Angle at 30 degrees. And inject until I get blood flow. I'm going to simulate that by pumping it. You can see the blood flow coming up. So I'm going to drop the wire, thread the catheter down. I'm going to occlude, remove my guide wire. I'm going to hook up my transducer. have my assistant zero the waveform, make sure it looks good, we're in the right spot, it's pulsatile. So then I'm going to secure my arterial line, dress it, and document the procedure, vital signs every 5 minutes for 15 minutes, and document how the patient tolerated it.